Climate change is accelerating, and so is its impact on public health. But some people are more vulnerable than others. Variables like age, health, location, all of these have different levels of risk from severe weather events. Today, we will focus on asthma because California is the most wildfire-prone state and has the greatest proportion of Americans with asthma, with approximately 2.5 million. The problem is, how do those who are at greatest risk know when the weather can exacerbate their health conditions? And how do they know what to do to avoid hospitalization? Introducing Bellweather, a medical app that leverages health information to predict risk before weather events occur, then provides personalized guidance on how to best stay protected. Let's learn about how we predicted risk.
Over the past 2 weeks, we built a random forest machine learning model to determine the risk of emergency care if exposed to air pollution. Using a dataset of over 10,000 simulated adults, we randomly assigned each patient a geolocation within the Bay Area coordinates and matched air quality data from wildfire seasons over the past 2 years. The predictive risks based on age, sex, disease status, and weather exposure were determined by literature review and expert opinion. When tested, our model was found to be highly accurate and reflective of real-world outcomes. Now, let's check out our working prototype, which will focus on air pollution. Meet Candace, Apple's simulated patient with asthma.
While she logs in, let's talk about how we built the app. Weather data comes directly from APIs from AirNow and the Weather Company. Medical records are accessed through HealthKit using Fire Data Standard. Now, these data are aggregated into Core ML, where our model predicts risk from forecasted weather in real time, then provides the most up-to-date preventive recommendations based on the user's health conditions. Now, as we continue, along the right side of the screen, logs will show you what's happening on the back end. So as she connects to the health records, we'll see that the app will actually recognize her diagnoses. Just one second. First, we'll give access. And as it does, Bellweather will actually recommend to take the respiratory symptoms questionnaire. This is a validated tool to define the severity of her current disease status. As she answers this, there'll be a list of possible medical conditions, for which she was given moderate persistent asthma. Now, Bellweather will use this information to guide preventive recommendations. Now, let's check out the design of the app.
So here we see the weather screen. In Bellweather, the mountains change color if the personal risk level changes. Right now, Candace is at no risk from the weather. As we'll see in the health page, this provides 2 tabs of health information. First, we see the prevention tab, where actionable information can be found. At the top, we see her predicted risk level, and below is the EPA's description of the current air quality. Next, it asks us about symptoms. If Candace was experiencing symptoms, the app could provide preventative recommendations from trusted sources on how to best use her prescribed medication. If she is not experiencing any symptoms, the app still provides methods on how to prevent exposure to air pollution. These recommendations would change as the weather worsens. The bottom section shows our questionnaire outcome, and if we toggle here, it shows the preferred guidelines for treatment from established health authorities. The next tab conveniently shows her health record pull from the health app. That's our first demo. Now let's pretend that Candace is going to sleep early. She's going hiking tomorrow. In the morning, she is notified of unhealthy air and her home screen has changed to reflect her increased risk. Although she is not experiencing symptoms, let's see what it would say if she was. It gives guidance to increase her current medication frequency and to call her healthcare provider if symptoms continue. But without any symptoms, the preventative recommendation says that she should avoid being outdoors. Now that Candace is aware of her risk and what the recommendations are, she can make an informed decision for her health. As we can see, Bellweather is designed to easily inform you of your risk and provide personalized guidance on how to best stay protected to avoid hospitalization.
So what's next for Bellweather? First, we want to emphasize that we really did our best to stay within medical legal guidelines and prioritize medical integrity by having multiple clinicians in environmental and pulmonary medicine consult on our app. Bellweather meets the FDA definition of software as a medical device and falls under enforcement discretion. With that said, we hope to reach millions of people by including more health conditions and weather events. Our plan is to have cash and insurance models to provide telehealth, remote monitoring, and medication fulfillment. Please join us in support as we provide personalized prevention for everyone at risk. Thank you.
Great, thank you. I'm going to start a timer for 3 minutes. If you want to stop sharing your screen in group 6, please be prepared to get started after the judges are done asking questions.
I had a question. So I'm confused. How are you using your data set? You took a bunch of people and you randomly placed them all over the Bay Area?
Yeah, so that's a good question. So the way we kind of worked about like using our data set and like simulating where the patients were first we basically like picked different locations within the Bay Area within like 9 different counties. And then what we did was we, restricted each county and had different like geolocations within like the different regions. And based on that, we were able to assign weather and the different AQI data associated with those like regions. So everything was like very interconnected in that sense. And we did do like a randomized method to assign all 10,000 patients in that way.
And now just to see how the system worked, or because you wouldn't know how these patients would respond. So what was the machine learning part of your project? That's what I don't understand.
Yeah, so actually there's a slide on this. If Anna, you could share your screen, the appendix slide. So basically the way this works is we did a lot of literature review, which basically assigned the different AQI risk scores as well as the biological risk scores. And so for example, a female with, so you can see here the AQI risk.
Okay, so that's what you're doing. Okay, so you're using this. It's not specific to a person. Okay.
Right. And kind of to add on a little bit more on the machine learning side, we also took data from the different AQI of the different regions. And then we also considered that with regards to like, different like conditions within the wildfire season across 2 years. So that's kind of how it all kind of played in. And then we did a test data set with around 5,000 patients and made sure that accuracy was still up to par.
I have a question. This is Sheila. Just curious, great job. I just was curious, did you do a competitive landscape analysis? Was there other models out there that you were comparing to or looking at that have been somewhat successful in this area? Just curious, your research on that front.
Models of what?
A competitive analysis. So if has anyone else been doing similar type of work? I was just curious if you had done some research around that.
Yeah, we did some research into the various applications that might be utilizing weather data and predicting risk. Now, person's risk from weather is not a novel idea. We base our model off from research. However, what makes this novel is our ability to connect to HealthKit and really personalize the approach by knowing their medical conditions and which medications. And so as we would with the ultimate plan to continue this further is to be more personalized with the type of medications that they have. We use the simulated patient that Apple provides, which is a woman with asthma, and she only has one medication, albuterol, which at baseline is already not part of the recommended guidelines. And so we could just build from that over time.
Great. Okay, thanks.